I'm really grateful that everybody took time out of this evening to join us at the Nasher Sculpture Center to develop our programming in art and healing from last year to expand it this year. I am very happy to share with you a talk I'm going to do tonight on the cultural impact of pandemics. And this is research I've done over the past 7 months, and I shared it with the university students out at UTD, and am very grateful for the opportunity to share it with the broader public that Nasher has given to me. I have a kitty who wants to join the conference tonight, so forgive me. At any rate, let's begin. Okay, we're going to go down here. This happened this morning. What we're going to cover are the history of 5 pandemics in the world that have really changed the way we think about diseases that affect human. And it's important to recognize that as far back as the Peloponnesian Wars in 430 BC, we have documented evidence of the pandemics. And much of this has been done through DNA, finding mass graves and coming to the assumption that not only in the historical writings of the time, but also in finding grave sites, that they can identify the different pandemics. Tonight, I'm going to use works of art to illustrate the horrors of these infections, and then discuss the impact on the economy, the politics, religious and cultural structures of society over history. Very quickly, the pandemics that I'll be covering tonight are the Plague of Justinian, which lasted until 750 AD with occasional outbreaks, and almost 30 to 100 million people were killed in in Asia and also around the Byzantine and Empire areas. The bubonic plague, which many of us know a lot about because it was it's also called the Black Plague, and that was from 1347 to 1353, and we know a lot about it, especially because of the documentation in European art in Italy. However, this plague went on first till 1720, and over the course of those 400 years, there were 200 million people that died. The Spanish flu, which we've been hearing a lot about, between 40 and 50 million deaths occurred around the world in that 18-month period. This is more than the number of people that were killed in World War I. With HIV/AIDS, as we know, it's been documented in terms of the history of medicine in the United States since 1981, although it was known in Africa, it just didn't have a name. But 32 million deaths have been recorded as of this year. And the coronavirus numbers continue to grow everywhere. You can see on the painting on the other side of this work is an example of the plague in the bubonic plague after one of its second outbreaks. This is just a visualization of the impact of the different plagues on human society. And as you can see, the bubonic plague is really one of the highest number of deaths that occurred, and it really has had that effect. I have had this problem this afternoon where these slides click back and forth. I apologize. The Plague of Justinian, which is properly known as the Justinian plague, he was, there's mosaics in Hagia Sophia and other places that document his role in Byzantine Empire. Justinian was really a conqueror. He liked to take the world and was trying to conquer it. And then the plague came in, and it was a complete shutdown of the Byzantine economy and empire. And as we know, the bubonic plague is carried by fleas, and it came through trade from China and Egypt. And these trade routes formed up into Constantinople and other parts of Europe. It went as far north in Europe as England. And it's a form of what's called the Yersinia pestis bacteria. And that little flea bites the human being, and then that person is contagious and gets the disease. But also in certain forms of bubonic plague, the blood and fluids of that individual can pass the plague on to other humans. So it's really deadly. There are many documented statements about how ravaged the world was. And this was the first documented pandemic. It contaminated 3 continents of the world at that time. An epidemic is just more localized. This is a comparison. Justinian, era images, not created at this time, but created later. But here he was, the mighty conqueror of the Goths, and killing people. On the other side is a mass grave that was found that documented the Justinian plague. And so many people died, they had absolutely no way to bury them properly, so they were thrown into open pits. The symptoms of the plague are very gruesome, and I'm not going to read them all, but it's characterized by coming on within a very short period of time after the infection. And some people would show an early symptom in the morning and be dead by the afternoon. So it was the swelling of your lymph nodes, the bleeding, the delirium, and the dead tissues cause for the complete deterioration of the body. In terms of the economic and cultural impact, one of the things it caused, as I said, was the fall of the Byzantine Empire. It was a huge effect on the political, economic, and religious upheaval. Many of the caregivers at this time were the clergy who helped to care for the sick people, and many others had to bury the dead, which became increasingly difficult. Trade ceased because they began to realize the impact, and also people would land in port and the ships would be empty because everybody on board had died. And this weakened every aspect of the Byzantine Empire. And the lack of food and food shortages dramatically changed the way people could live. Whole towns were wiped out. And it led to the end of serfdom as people knew it, and actually started the Dark Ages, a period of difficult decline in Europe, but also filled with amazing works of art. This is another recreation of the plague, but you can see it had no, it did not affect one size of aspect of the population. It was everyone who got infected. As you can see here, young babies, mothers, elderly people. And as the plague spread more rapidly, more and more people became immune to it, which was a good thing. There was, after the plague was over, it took a long time to recover, but people began to have more food and to eat better after the plague, those who survived the plague. And then very importantly, improved sanitation came into being, and the disposal of the dead, which, as you can see in these earlier pictures, they were mass graves and only covered with a thin layer of dirt, which did not really protect people. As if this wasn't enough, and of course there were no medications at this time and no doctors with the kind of skills that we have today. And the same is true at the time of the bubonic plague. And the first bubonic plague was really around the 1347 to 51. And this is documented in many works of art throughout Europe. And here we see, this is a much larger panel that was created, but you see the figure of death triumphing, and it's a fresco that was done to remind people of the ravages of the plague, and that no one, whether you were a king or a layperson, was unaffected by it. And you can see royalty down here in being falling into the illness, and ladies in the court. And there's some evidence of masks being worn at this time. Sorry, As I said, it had a ravaging effect. Approximately 30 to 60% of Europe's population was killed by the plague over the years. And over the 200-year period, it took 200 years for the population really to recover. As outbreaks kept occurring, there's the very famous London plague, which you probably heard about this year, where Newton went off and Shakespeare went off, leaving London because so many people were dying. And in the countryside, they wrote masterful plays and discovered scientific theories. So it was during this time that knowledge and the spread in the 1500s that was so important to life today. You'll be surprised to learn, and I'll show you an example of the localized outbreaks that still occur today. Almost 3,000 people a year, die of the plague. As I mentioned, the Yersinia pestis is inside this little flea. And unfortunately, it's the same strain of the virus or the infection, the bacteria infection that was in the Justinian plague. And that was proven through DNA samples shared from grave sites during both the Black Death and the Justinian plague. The infection spreads from the rodents, rats predominantly, but also dogs as they became more infected once they reached the land. And it was divided into three major types of bubonic plague. There was the bubonic plague itself is probably the best known, and in terms of that, you would have a sudden fever and a headache and tremendous weakness, but your lymph nodes would expand and very, very painfully. And those are called bulbous, and that's where the name of Black Death came from, or the bubonic plague came from. Septicemic plague is you have these early symptoms are the same, but unfortunately you start bleeding from every orifice, and that is nothing can be done for you at that, and in that particular stage. You develop many other complications as a result from these flea bites that lead to your death within a short period of time. And then the pneumonic plague, again, spread through the fleas and the transference of body fluids. You develop the same early symptoms, headaches, fever, etc. But now it really attacks the pulmonary system, and inhaling the infectious droplets was the predominant cause in this particular kind of the plague. So it was the handling of the bodies and the curing of the sick or family members caring for them. And this led to the shutdown of your respiratory system. So every aspect of this was pretty gruesome. Sorry, it keeps going backwards. I apologize. One of the saints during this time was Saint Roch, and he went in and there's some reports that he laid on hands and helped to cure the patients. This is a scene of him in the healing phase, and people would show them their bloody sores and the difficulty and pain that they were going through. And of course, you can see their loved ones trying to be helpful. And we know that these scenes led to the death of many of the other people that were caregivers in the room. The economic impacts, and this is another painting of St. Roch on the other side from 1480 that was done. You can find in Venice. All cities in Europe were affected by the plague. And the important thing to realize is that this plague led to the decline of serfdom. At the end of it, standards of living increased. And unfortunately, during the plague, sheep and dogs and goats and dogs and cows all became infected. And also, there were food shortages. There was an upsurge in mysticism and bigotry and scapegoating. And this is, you see many cases of flagellation on the human body, trying to offer yourself to God to save yourself and others. And unfortunately, great scapegoating and racism against the Jewish population. The one thing as a woman I can tell you that came out of this, which was pretty impressive, was that because there was such a shortage of men, women were allowed to own land, to join guilds, and to run businesses, which had not ever been present before. And by the end of the plague, it led to the Renaissance in the coming years. One of those pictures from the Renaissance, so you can still see it was still rampant, is this one by Peter Bruegel, The Triumph of Death. And you see Death in the very center here, marching in, and his foot soldiers, wiping out an entire town. Oh, sorry. You know, coming in and killing the death of many people, and the many figures, the bodies and bones being carried. The king over here clearly dying of the Black Plague. So these were images that were part of people's experience in life, and they were documented the way we do have documentary photography of the hospitals and of the grave sites of that have been so much a part of our visual understanding of the impact of the COVID virus. It was the artists at this time that did this documentation. And if you look carefully, you see the ships, which brought the plague in. I'm so sorry, I'm not touching this. Oh well, we'll just move on. I just want to show you this one image in the back. You can see the ships here that are sinking or being burned. And that was one of the few things they could do when a ship landed in port. They would, and people were infected, they would send it back out to sea, and ultimately many times it would get burned because there was no other way to handle that situation. There were a lot of health improvements, and during the Renaissance, again, it lasted for a long period of time, the plague did. And one of the most notable that we hear so much about today is wearing masks. And the whole notion of the quarantine came from Venice, and they originally started to quarantine the ships for 30 days, but they found that didn't really work. And so 40 days, or quattro, however you say it in Italian, quattrocento, is why this quarantine how the word quarantine derives its name from 40. It was a very important way to deal with with the epidemic as it came in. Medical masks were really invented during this time, and although this looks very strange in the illustration that keeps bouncing around, again, my apologies, it just really wants to get you to this political scene. I'm trying not to get frustrated. But what's so important about this is a doctor in Venice who is wearing leather garments and they made hoods. And the hoods were then, with those long beaked noses, those noses were stuffed with rosemary and rose petals and other kinds of sweet smelling herbs. The eyes were covered because they had already determined that the virus, that the bacteria from blood could affect them. So they wore gloves at this time. And all of these medical treatments were being learned. And so while this may have been, the thing to do as a doctor if you were going to care for patients, it also had a huge influence on future epidemics. That is social distancing and medical masks. Of course, today I'm glad we're not all going around with that kind of a mask on our faces. It would be pretty tough. And they were made out of leather, covered your full head, and they were very hot. Many complaints about that. The other thing besides sanitation was, if you think back to this period in history, many of the houses had thatched roofs, and that is where rats could live. And so that type of structure was removed, and the houses began to be made of brick instead of other more natural materials that would invite the rodents to stay in. And there's a whole list of other preventative actions that began during the Renaissance and were carried forward even to today. I put this picture in, even though it's very late in the plague period, in fact, done afterwards, but it's a political document. It shows Napoleon visiting plague victims in Jaffa, and there's a report that he went in and physically touched a plague victim who was ill and in quarantine, as you can see with other victims. And Napoleon is shown here. His attendant is behind him and is covering his mouth because of the smells at this time. And you can see the number of sick individuals all around him, and the doctors over here, and people pleading for their lives. The truth is, there's a lot of question as to whether this scene really happened. And it was definitely painted after the plague was quiet in Paris and other parts of Europe. The reason it was done, it was Napoleon trying to lay claim to his stature as a leader and to point out his great compassion caring for his citizens. I will not make a political commentary on that. Just to give you an illustration, in 2017, I'm sorry if you're grossed out by this picture, but it gives you a very clear example of what the impact of the plague is. This poor man's cat was eating a mouse. He pulled it out. He got bit and ended up with a bubonic plague and loss of several limbs. Also, it's a reminder that even today, 3,000 to 5,000 people around the world, largely in Africa and India, still contract the bubonic plague. So it's still with us. The good news is now we can have IV antibiotics to treat the plague, and had those been in existence back at the time of, during the 400 years of the bubonic plague, it would have been a very different time. We're moving on to the Spanish flu, or H1N1, which was about 18 months in its tenure. And as many of you know by now, it is not properly designated as that's a misnomer, Spanish flu. The reason it is called the Spanish flu is because Spain did not participate in World War I. And as a result, it was the only press that was documenting the spread of this this severe virus that was affecting people in Europe. And what we found out is that because it was their ability to free press to get the word out, it became more there was greater awareness about the Spanish flu. There are many things in the Spanish flu that parallel what we are experiencing today here and probably in 1918. All of the police department in Seattle is wearing masks and heading out on the street. They don't have hand coverings, which would have been good for them to have. 500 million people were infected, almost 30% of the world's population. And we see our numbers growing every day. We're only 6 months into our current pandemic. And despite the great improvements in medication and in healthcare, it's very different. The war claimed 20 million lives, people who lost their lives through death on the field. But many more were lost than that through the Spanish flu. And we often don't know that, but it was a huge killer. It spread throughout Europe and the trenches, and there are many assumptions about where it began. Some reports say it was in Kansas City, and the United States troops carried it across to Europe. Others say there's documentary evidence in France of the flu breaking out there. We will never know. We just know the impact that it had. And the field of epidemiology, which we have so many doctors like Dr. Fauci that we follow, developed during this period of time. There wasn't a part of medical history that had the epidemiologists, partly because they did not have the equipment. The microscope was developed in the late 1600s and was very primitive, but by this time they did have microscopes, but they didn't have any antiviral medications the way we are hoping for in the coming year. The symptoms, if you read this set of symptoms, you can see it's very, very similar to what the coronavirus is represents the coronavirus. I think there's one of the differences that it really, this particular virus really attacked young people, and the young people were, by that we're talking about the 20 to 45-year-old population was severely affected. There was massive ads in the papers, you know, telling you to wear masks and how to prevent influenza. You can read this wonderful, you know, don't drink out of common cups, cover your mouth when you cough, all things we hear about today. Worry about some of the symptoms. If you're in a sick room or walking into an office, wear a mask. This is a scene shortly, just a few weeks after the influenza broke out in Fort Kelly, Kansas in the United States. And what happened is one soldier came down with it. By the next day, there were 9 soldiers who were sick and in the infirmary. And within a week, they had hundreds of soldiers at this camp that came down with a virus because it spread so easily. And you can see some of the common mistakes. Here's a doctor caring for an influenza victim. Both of them don't have masks on, yet in the next area they do. So it was, while they knew some of the health practices to be preventative, they weren't always followed. And it was through this that contagion continued to happen. There were scenes that you see today, healthcare workers making the masks, people trying to use public transportation, keep our streets clean, and very importantly, trying to get the children back to school. Just like today, theaters, schools, museums, churches, everything was closed. There was a tremendous cultural impact from this outbreak, and the deaths of people, as I said, 15 to 45 or 20 to 45 was huge. And that affected a whole population of women who didn't have husbands to get married to. There was an economic disruption throughout the world, just like we're experiencing today. Loss of trade, food, supply was broken down, retail stopped operating. And more women went into the workforce, especially into medicine, because so many people were dying. So it was really, really tragic. Klimt, who you can see with the figure of death over here, painted this picture before the tragedy of his wife and their unborn child died of the flu, and they died first, and then later he died of the flu, all within about 6 months of each other. So this powerful record of a very personal response by an artist is very much an experience. Egon Schiele also went through this tragedy, where he's painted here with his wife and child, and they had very similar deaths due to the influenza. Out of the influenza came a lot of the things that we're talking about today: healthcare for all, social distancing, isolation for use, people in the public and medical areas. Epidemiology grew as a field of study and made major changes in the 20th century. Okay. And there were a lot of gatherings systematically became more popular. I got a warning that I need to go faster, which is always the case. So we're now into HIV/AIDS, and this immune deficiency. It's different than, it's also a virus, but it's different than the H1N1 or the coronavirus today. And unfortunately, 32 million people have died. And there are a number of very distinguished artists like Felix Gonzalez Torres who have made works that represent this passage of time and loss. In this case, he's using a pile of candy you can eat this candy and walk away, but it's also a memento mori. We know that sexual intercourse, sharing of injection drugs and equipment, body fluids are all have an impact. Mother and child contact have an impact. However, it cannot be spread through shaking hands, hugging, going to the bathroom, and all these other things. And you probably all remember the tragic story of a young boy trying to go to school, Ryan, where he had AIDS. He contracted it through a blood transfusion, but once his story came to life, there was a deeper understanding of the transmission challenges. Public health improvements, a lot of those have been made. I think the biggest thing to note actually is that we now have antiviral medications, and these antiviral medications have helped to stem the death toll and have increased people saving their lives by $13.6 million, those who go on the antiviral medications. We can see Hugh, this wonderful artist, Hugh Steers, who is caring for his partner in this most poignant of all scenes, you know, the washing of his body and caring for his withered limbs as he's wasting away. And I think this is such a wonderful painting in terms of capturing the emotion of what men and women went through. Another aspect of the AIDS, the memorial quilt is something we, many of us saw when it was displayed at the National Mall in Washington, D.C. Today, each panel is made out of sewn by individual who lost a loved one, and the panels are 3 by 6, and then those panels are sewn together into a 12 by 12 inch strip, which you can see here, and that is laid on the ground. And today there are literally, if you laid out all the names, because the quilt still is being produced, it would end up covering 1.2 million square feet. It would no longer fit on the mall in Washington, D.C. So efforts have been made to digitize it. I am so sorry about this, flipping. And now, thanks to Ann Balsamo, the Dean of Art and Technology at UT Dallas, there's a digital version of the quilt that is being cared for and produced, and you can look up the names of the people that you have lost and identify them and read about their stories. So it is moved from this almost one of the great pieces of folk art to being a living memorial to everybody, and it's still going on today. Perhaps the most poignant of all the images of the AIDS virus is Felix Gonzalez Torres' great clocks, and it is titled in Perfect Lovers. The clocks are set with new batteries. They are set at exactly the same time, but over time they run out asynchronistically. And as a result, when they stop at different times, just the way he and his partner ended their lives. The COVID virus today, there's so many pictures of empty spaces, but I had to pick Disneyland as a reminder of the months and months that it's closed, and now it's only open partially. As I said, coronavirus is a part of the viruses that have been around forever, and it's spread through airborne droplets. And as of the world has seen almost 29,000 deaths and a million deaths, and America is coming up on 200,000 deaths. And the World Health Organization estimates between 40 and 70% of the globe by the end of this virus will have been infected. The symptoms we all know today, and what's interesting to me is there's a whole series of artists, like photographers, who are documenting the death of and the tremendous work that hospital care workers are undertaking to prevent the virus and to prevent individuals from dying. And these photographs, before we saw frescoes and paintings, but now this is being done as the documentary evidence of the COVID virus. Just the beginning of our understanding about the vulnerabilities we all experience. It is, immediately we ran out of personal protection equipment. Also where it's made is in China, since the majority of our medications and the PPE is made in another country, and they were the origins of the flu of this particular virus. It really impacted us. There's a disproportionate impact on vulnerable populations. By that, I'm referring to the elderly, minorities, the people who are incarcerated, people who have secondary infections and chronic illnesses. And it started a whole series of supply shortages, as we all remembered, and bought lots of toilet paper in the early stages. Today, business closures are all over the country, and in our city, you see more and more small businesses closing up for good. There's also the impact of the schools, universities, and college as they move to digital learning, but also as they become centers for the spread of the virus. And then canceling of major events, the 2020 Olympics, and for us here in Texas, the Great Texas State Fair. There's a communication impact that I think all of you know about. The digital divide between the people who have computers and don't is very dominant right now, and really affecting the ability of teachers to teach our elementary through kindergarten, through high school students. Face-to-face learning is now digital learning. We are not happy this. And pardon me, and the home internet usage has gone up by 60%. If you use Zoom, you can see that extraordinary number on the screen of increased usage. Though I will tell you tonight, I'm not very happy with how my Zoom slides are showing. There are many artists that began to respond to COVID right away. And Sean Scully, an artist who you see a lot of his work over at Fort Worth Modern, did. And he started, he had done a series of paintings, and then he went back into them, and many of the paintings that he's producing now, where he's used squares a lot, but he's now put the black square in the center of the painting as a reminder of the emptiness and the void and the loss that people are going through as a result of death. The artist Mark Bradford, also currently being shown over at Fort Worth, has just recently unveiled a series of works about the solitude and the impact of isolation on his work. Normally, when he does these huge canvases, he has many people working with him, laying strings and helping him to create the maps. And he's doing these now all on his own. The second thing to recognize is that he is calling them Q1, Q2, Q3, there are 6 in this series. And the reason for that is he's talking about them as quarantine paintings, paintings created out of the fear and loss of these times. The Nasher has done a series of wonderful projects over the summer, and I really want to commend the creative curators and Jeremy Strick for coming up with this idea, where they use the foyer of the Nasher as a way to help tell the stories with young artists in our community with works of art. And I'm only picking 2 out of the many that were up. This one by Sarah Cardona particularly appealed to me because she's using a very popular form, the piñata, as a microcosm for all the travails socially, and also referencing the figure of the coronavirus in her work. And this has almost a shamanistic quality, but the piñatas are also symbols of good hope, and you can see the reflections and colorful nature on them. And these, I think that she is trying to get us to be in a wonderful place, dispelling our fear, but also embracing our fear. Another artist who did an installation was Lily Hansen, and she did these absolutely gorgeous cut paper installation that floated in the Nasher vestibule for a week. And it was, she was responding very specifically to the her personal reflections on the uncertainty of the time, on the need to be quiet and reflective, the need to find a space that could be not filled with the constant sounds of the television blaring bad news at us, whether it was the racial unrest or the terrible situation with the COVID virus. All of this was impacting us. And so she wanted in her work to find another place in which to articulate. The last slide today is, I think, one of the truly beautiful representations of the COVID virus that Luke Jerm did. It's made out of glass. You can read his wonderful commentary on it, but it is, you know, it's kind of a symbol. On the one hand, it looks very much like the coronavirus. It also has images of this, references to the sun and to radiance, and our hope for control, that it is about light, and in time we will see that light again. Quick review of what we've covered tonight: the Justinian plague, the bubonic plague, Spanish flu, HIV/AIDS, and coronavirus. There are so many plagues, smallpox and typhoid fever, that I could have covered, but I picked these to help demonstrate some of the relationships between the different outbreaks of pandemics, and also to give you some direct insights as to what happened in each area time period to improve healthcare. And I don't know of any personal collectors that are amassing this work. I'm doing a seminar in October for the Edith O'Donnell Institute, and it will be open to the public if you want to join that. And I will be showing a tremendous number of contemporary artists that are responding to COVID. It'll be interesting, and I'm sure some of the collectors will start in this area. And I know that museums already, the Smithsonian and some of the other museums, are beginning to collect works of art that are being produced by young artists or elderly artists, like that we saw earlier when you see works by Arlene Schecht and also by Sean Scully and Bradford, those are all going to go into collections, private collections, and into museums. So this documentation will continue. Oh yeah, and that's part of the ephemera that's being collected, you know, and the personalization of masks, which I think many of us are going to be wearing for years because of the easy spread of the virus, even though we know other people won't wear them now. What's interesting is that you're seeing more and more people personalize these for their own use. And I think that going forward, some of those will become pieces of art in folk art collections and in decorative arts collections. But we just don't know right now, but yes, that's going on. I think that you're seeing the first of that response in Mark Bradford's work. Many artists have had their shows canceled, have been working in isolation. Somebody points out that Lady Gaga is decorating her mask, so how unsurprising is that? But the need for creativity drives artists, and you saw this in the Nasher Windows series, drives them to produce works of art. And I think that that is definitely going to push forward. I also think that the loss of a sense of community that we're experiencing right now is going to have an impact on people. I, for one, you know, the big event today was I actually stepped into Eatsy's for the first time in 7 months. If you can imagine, because I have to be so restrictive in my outings. And I was in shock being around that many people. So I think that as communities reemerge, it will be challenging to reset the standards of normal. And some people are very respectful about social distancing and other kinds of things, and other people are less understanding about that need for compassion. So I think you're correct that both the concept of isolation and the need for community and communication is going to drive, especially in the next year or so, the production of work by artists. And it will be fascinating to see this as we move forward.